Core strength becomes increasingly important after age 50 for maintaining balance, preventing falls, supporting spinal health, and preserving independence. However, not all core exercises are appropriate or safe for older adults. Today we're covering 3 safe effective core exercises specifically suited for people over 50, plus 3 common exercises you should avoid due to potential risks. These movements can be performed at home with minimal equipment. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have back problems, osteoporosis, or other health conditions. Understanding core strength after 50. Your core consists of multiple muscle groups including abdominals, back muscles, pelvic floor, and hip muscles. These muscles work together to stabilize your spine, support posture, enable movement, and protect your lower back. After 50, core strength naturally declines without regular exercise, contributing to balance problems, increased fall risk, lower back pain, poor posture, and reduced functional independence. However, appropriate core exercises can help maintain and improve core strength. The key is choosing exercises that strengthen effectively while protecting the spine and joints from excessive stress. Part 1, 3 safe core exercises for over 50. Exercise 1, Supine Marching for deep core activation. The first exercise is supine marching, which activates deep core stabilizers with minimal spinal stress. This movement is particularly safe because it's performed lying down, eliminating balance challenges and limiting range of motion to protect the lower back. Here's how to perform supine marching. Lie on your back on an exercise mat with knees bent, feet flat on floor hip width apart. Rest your arms at your sides. Gently engage your core by drawing your navel slightly toward your spine. Maintain this engagement throughout. Slowly lift your right foot 2 to 3 inches off the floor, bringing your knee slightly higher. Your thigh rises while knee stays bent. Lower your right foot back to floor with control. Repeat with your left leg. Alternate legs for 10 repetitions per leg, 20 total. Rest briefly. Complete 2 sets. Practice 3 to 4 times per week. Important form points: keep your lower back in contact with the floor throughout. If your back arches, you're lifting too high. Move slowly and deliberately. This isn't about speed. Breathe naturally, exhale as you lift each leg. Keep the movement small and controlled. Higher isn't better. Modifications: if this feels too challenging, simply slide your heel along the floor rather than lifting. This still engages core muscles with less demand. To increase difficulty once basic version is mastered, hold each lifted position for 2 to 3 seconds before lowering. What to realistically expect: with regular practice 3 to 4 times per week over 4 to 8 weeks, you may notice improved awareness of core muscle engagement, better spinal stability during daily activities, reduced lower back discomfort in some cases, and improved foundation for more challenging core work. This exercise rebuilds the mind-muscle connection with deep core stabilizers that often become dormant with age and inactivity. Exercise 2, Glute Bridge for posterior chain strength. The second exercise is the Glute Bridge, which strengthens your glutes, hamstrings, and lower back muscles while engaging core stabilizers. Strong posterior chain muscles are essential for standing from seated, walking, climbing stairs, and protecting your lower back. Here's how to perform the Glute Bridge. Lie on your back on a mat with knees bent, feet flat on floor hip width apart and close to your buttocks. Arms rest at your sides. Engage your core gently. Press through your heels and squeeze your glutes to lift your hips off the floor. Raise your hips until your body forms a relatively straight line from shoulders to knees. Don't arch your back excessively. Hold this position for 3 to 5 seconds. Lower your hips back to the floor with control. Perform 10 to 12 repetitions. Rest briefly. Complete 2 sets. Practice 3 to 4 times per week. Key technique reminders: lift by squeezing your glutes and pressing through heels, not by arching your lower back. If you feel excessive pressure in your lower back, you're likely arching too much. Focus on glute engagement instead. Keep your core engaged throughout to protect your spine. Your neck and shoulders should remain relaxed. Don't push into the floor with your upper body. Modifications: if full bridge is uncomfortable, lift only part way. Even small lifts provide benefits. For increased challenge, place a small pillow or ball between your knees and gently squeeze it during the bridge. This adds inner thigh engagement. You can also hold the top position longer, up to 10 seconds. What to realistically expect: with consistent practice 3 to 4 times per week over 6 to 10 weeks, you may notice stronger glutes and hamstrings for standing and walking, reduced lower back strain during daily activities, improved pelvic stability, and better posture. The bridge is one of the most functional core exercises because it strengthens muscles you use constantly for standing, walking, and transitioning from sitting to standing. Exercise 3. Modified Bird Dog for stability and coordination. The third exercise is Modified Bird Dog, which challenges core stability, improves coordination, and enhances balance. This exercise is excellent for preventing falls because it trains your body to stay stable while limbs move independently. Here's how to perform Modified Bird Dog. Start on hands and knees on a mat. Position hands directly under shoulders, knees under hips. Keep your back flat and neutral, not arched or rounded. Engage your core by gently drawing your navel toward spine. Slowly extend your right arm forward to shoulder height while simultaneously extending your left leg back to hip height. Your arm and leg should form one relatively straight line with your torso. Hold this position for 3 to 5 seconds, keeping your hips level. Don't twist or tilt. Lower your arm and leg back to starting position with control. Repeat on opposite side, left arm and right leg. Perform 6 to 8 repetitions per side. Complete 2 sets. Practice 3 to 4 times per week. Important form considerations: keep movements slow and controlled. Balance and stability are more important than range of motion. Maintain a neutral spine throughout. Don't let your back sag or arch excessively. Keep your hips level. Avoid rotating your pelvis as you extend your leg. Only lift your arm and leg to comfortable heights. Full extension isn't required. Modifications: if the full movement is too challenging, start with arm-only or leg-only variations. Lift just your arm while keeping both knees down, or lift just your leg while keeping both hands down. These simpler versions still provide excellent core strengthening. For more challenge, hold the extended position for 8 to 10 seconds. What to realistically expect: with regular practice 3 to 4 times per week over 6 to 12 weeks, you may notice improved balance and coordination, reduced fall risk, stronger core stabilizers throughout your trunk, better body awareness and control, and improved confidence during daily movements requiring balance. The bird dog is excellent for training the stability you need for real-life activities like reaching while standing, turning while walking, and maintaining balance on uneven surfaces. Part 2, 3 core exercises to avoid after 50. Exercise to avoid 1. Traditional situps. Traditional sit-ups involve lying flat and repeatedly lifting your entire torso to your knees. While once considered a standard core exercise, sit-ups are now recognized as potentially harmful, especially for older adults. Why avoid sit-ups after 50? They place significant compression force on spinal discs with each repetition. After 50, spinal discs lose hydration and become more vulnerable to injury. They often cause neck strain as people pull on their head to complete repetitions. They heavily engage hip flexors rather than abdominal muscles. Tight hip flexors contribute to lower back pain. They can worsen existing back problems, disc issues, or osteoporosis. They don't train functional movements used in daily life. The risk-to-benefit ratio is poor for older adults. Better alternative: the 3 exercises we covered, marching, bridge, and bird dog, provide superior core strengthening without spinal compression risks. Exercise to avoid 2. Straight leg raises. Straight leg raises involve lying on your back and lifting both legs straight up while keeping knees extended. This creates significant stress on the lower back. Why avoid straight leg raises after 50? they create substantial load on the lumbar spine. If core muscles can't fully stabilize the pelvis, the lower back compensates, leading to strain. They primarily work hip flexors, not abdominal muscles, creating muscle imbalances. They can aggravate disc problems, sciatica, or lower back pain. They're particularly risky if you have weak core muscles, which most older adults do without specific training. The movement doesn't translate to functional daily activities. Better alternative: supine marching with bent knees provides core strengthening while protecting the lower back by maintaining knee flexion and limiting range of motion. Exercise to avoid 3AB machines with heavy resistance. Many gyms have dedicated abdominal machines where you sit and crunch forward against significant resistance. While these may seem effective, they're often inappropriate for older adults. Why avoid heavy resistance of machines after 50? They lock your spine into repetitive flexion under load, increasing disc compression. They don't allow natural spinal movement, forcing your body into fixed patterns. They often create excessive stress on the lower back and neck. They isolate muscles in ways that don't reflect functional movement patterns. They can worsen postural problems by overworking certain muscles while neglecting stabilizers. They're particularly risky if you have osteoporosis, previous back injuries, or limited mobility. Better alternatives: bodyweight exercises like the 3 we covered train your entire core system to work together for functional stability and strength without excessive spinal loading. Creating a safe core routine. Here's how to incorporate safe core exercises into your routine. Perform the 3 safe exercises: supine marching, glute bridge, and modified bird dog, 3 to 4 times per week. A complete routine takes 10 to 15 minutes. Start with 1 set of each exercise, performing repetitions within the ranges suggested. Progress gradually by adding a second set after 2 to 3 weeks, then increasing repetitions or hold times as strength improves. Always prioritize proper form over number of repetitions. Quality matters more than quantity. Listen to your body and modify exercises as needed. Important safety considerations: core exercises support spinal health but must be performed safely. Stop any exercise that causes sharp pain, radiating pain down legs, significant increased back pain, or dizziness. Mild muscle fatigue is normal, but joint or nerve pain is not. Consult your healthcare provider or physical therapist before beginning core exercises. If you have significant osteoporosis, recent back surgery or injury, herniated discs or sciatica, severe spinal stenosis, or significant balance problems making floor exercises unsafe. These exercises work best combined with regular walking, proper posture habits, adequate calcium and vitamin D for bone health, and other healthy lifestyle practices. Realistic expectations for core strengthening. Core strength improvements occur gradually. Weeks 1 to 4, learning proper form and technique, initial neuromuscular adaptations, improved awareness of core engagement. Weeks 4 to 8, exercises feel more natural, some functional improvements may be noticeable, ability to progress repetitions or difficulty. Months 3 to 6, clearer improvements in core strength and stability, better performance of daily activities, established sustainable routine with continued progress. The goal is gradual sustainable improvement supporting long-term spinal health, balance, and functional independence. Conclusion: these 3 exercises, supine marching, glute bridge, and modified bird dog, provide safe effective core strengthening for adults over 50. They protect your spine while building the strength you need for daily activities. By avoiding exercises that place excessive stress on aging spines, sit-ups, straight leg raises, and heavy resistance of machines, you reduce injury risk while still effectively strengthening your core. Start with proper form at comfortable levels. Progress gradually over weeks and months. Practice consistently 3 to 4 times per week. Most importantly, remember that safe effective exercise is always better than intense risky exercise. Thank you for watching. For personalized guidance on core exercises appropriate for your specific situation, consult with a physical therapist or healthcare provider. Subscribe for evidence-based information on safe effective exercise for older adults, practical guidance that prioritizes your safety while helping you maintain strength, stability, and independence.